Okay, there we go. Welcome back, Dr. Pei. This is our
Hey, G.
regular. Hi, how you doing?
Good, good.
Good. This is our regular once a month. Ask Dr. Pei anything you want. We talk about menopause, perimenopause. We could talk about autoimmune and everything else sort of associated with women's bodies as they begin to age. So we focus mostly, our company focuses on women who are ages 40 plus. But Dr. Pei has a practice. He has over 6,000 patients worldwide, and so he can talk about anything, but we focus this conversation on menopause, perimenopause, and all of those things that frustrate women and their partners, right? Because their male partners get impacted when the women are impacted. So Dr. Pei is also the Chief Medical Officer for T Botanics. In T Botanics, we create a unique line of life stage specific tea supplements that focus on balancing the body, specifically the body of women right now. So, Dr. Pei, we have some questions that have come in. It's going to be interesting because they range from wanting people that know more about RT to, of course,
Mm.
the typical menopausal kinds of questions. So, I'm going to start with the first one. What are some of the menopausal symptoms caused by age-related decline of estrogen specifically?
Okay. Uh, as we know, after we hit menopause or perimenopause, both estrogen and progesterone decline. But since I don't like to memorize the symptoms, it would be better for the viewers to go into, different parts of the body. For example, okay, well, let's say the first ones would be obviously a brain cognition decline, as estrogen would protect the brain in that way. You would get brain fog, which a lot of the menopausal or perimenopausal women probably experience. They would feel fatigued. And also, because of that omega 3 decline, they will also feel headachy. The immune system also goes into an overdrive as estrogen declines because the immune system will go into a heat fervor. So people will get hot flashes. Not every woman, but typically when we see hot flashes, we can go, okay, well, we're in not just a hormone imbalance of estrogen and progesterone, but we're looking at an immune system. So moving down, here, obviously it affects the thyroid. So typically you would hit into sometimes a hyper or hypo. Okay, in the hyper, you are looking at possibly Hashimoto's or Graves. But again, hyper and hypothyroid could go both ways. Okay, looking down at the heart, so estrogen has a cardioprotective property, which means that you rarely hear women deal with heart issues or cardiac issues. Palpitations are a different category, but you rarely hear them get heart attacks. That is something that usually happens after menopause because estrogen protects the heart by making the blood vessels more flexible, less plaque buildup, etc. All right, let's see what else. Bones. Okay, so estrogen protects the bones. So when you hit menopause, it is natural that women start to develop into more of an osteopenic state or osteoporosis state. Osteoporosis would depend on two things. I mean, obviously, the bone is not just calcium, but is a host of different collagen, calcium, magnesium, zinc, potassium, or all these minerals in there. So when you have these minerals, estrogen actually helps the bone osteoclastic activity breakdown. So if you don't have enough estrogen, you would tend to become osteoporotic. So the same could be said on progesterone because progesterone builds osteoblastic activity, which means it helps the bone build. So estrogen helps it break down and then build. So there is some of that. And finally, with going down even further into the vaginal area, when you have a low estrogen amount, especially with stress, then the vaginal tract or the linings, everything gets thinned out. And when they get thin, there is going to be more rubbing, there is more friction. You tend to get more yeast infection or BV, bacterial vaginosis. And that's where they have to have some sort of probiotic, acidophilus or bifidal, or specific strains just to help their tracts get better. So an immune system is very important. As we probably know, 60 to 70% of our microbiome in the gut is in charge of the majority, the immune system there. So let's see, anything else I missed? It might be more, but there's too many. But I just kind of went down from top to bottom so we get a glimpse of how estrogen protects and balances the body.
Perfect. So why don't we talk about what are some symptoms when you have progesterone decline?
So progesterone, like I just mentioned, it also helps. It would help more on the depressive side. So, for example, if ladies have emotional issues, ups and downs like PMS, it's more of a progesterone deficiency. When you have that, you also progesterone deficiency also leads to hot flashes. When you get hot flashes, then we're going to be looking at something else, some other hormone imbalances. But also, progesterone helps you burn fat, helps you lose weight in the belly, for example, because your estrogen will tend to build in the adipose tissue. So progesterone helps you burn those things. And progesterone helps you make testosterone, which means it'll give you more energy. Gives you less depression, more energy, and a more general well-being, kind of thing.
So how do you restore or bring back up your low levels of progesterone and low levels of testosterone if that's what a woman has and she's having fatigue and belly fat? What can you do? Is that where the bioidenticals come in? Is that where is nutrition a point there, or?
It's a good question. Now, however, when you feel fatigue as a holistic doctor, you kind of have to look at the whole thing. Obviously, we recommend once a year you do a blood test, or if you have to, once every 6 months, never less than 4 months apart. You want to do a blood test just to see if you're truly just hormone deficient. Now, in my office, I do muscle testing in conjunction with biofeedback and blood tests. So we have a three-way confirmation in order to validate whatever we find. Typically speaking, if you have fatigue, you have to look at the mitochondria. And the heart has really abundant mitochondrial, congregations. If you look at the mitochondria, if you're not making energy, ATP, in there, then we have a problem. We just mentioned that estrogen could help the heart, it protects the heart. So if your mitochondria is not really having an adequate output, then you would have fatigue. But as we also mentioned in the previous AMAs, sometimes when you go into perimenopause or menopause, your adrenal has to take over. Now, how much stress we have individually is it's up for debate, meaning what I perceive as stress may not be that much stress for the other women. So if that stress is a lot for that woman, then their cortisol rises, their prolactin rises, and then that will cause a problem to fatigue. So it's really hard to pinpoint which one. This is where I go, go to your doctor. They will be able to figure it out, or at least guide you to a direction. I mean, you have to be moving in the right direction if you also fix hormones. It's just that if you go into a few months of hormone intervention, whether it's bioidentical or natural routes, if it doesn't get better, then probably missing something. That said, not all doctors are able to help everybody. There are so many factors involved. I mean, ranging from xenobiotics, chemical poisons in the world, in the environment, the water, the food, the hormones, the infections, excuse me, the infections. There are so many things in this world that could affect that hormone imbalance. So I would say check with your doctor, but always start once a year, maybe with some blood testing.
So, what kind of blood? I mean, you normally when you go and get your regular blood panel, it's just a regular basic blood panel. So, are you talking about that blood panel, or are you saying to your doctor, I need to have a blood panel that's also going to check all of my hormones, specifically my reproductive hormones?
So that depends on the complaint of the patient. If they have an autoimmune condition, I have to run different autoimmune panels if they want to, because for one, they have to take a lot of blood. That makes you anemic. And a lot of autoimmune patients are anemic. So it's kind of like this. You want to take blood tests, but you don't want to. If you're complaining about hormones, sometimes you don't have to run blood tests because blood tests may not be all that adequate for yeah, it may not be all that adequate for hormones. Sometimes you want to run saliva tests. But if you're perimenopause or menopause, you could run at least thyroid stimulating hormone. You can run follicle stimulating hormone. You can run a blood test called inhibin or activin, because as the two go up and down, you can kind of gauge if you're heading into that menopausal stage. You can check for a luteinizing hormone, etc. But you can also check for estrogen and progesterone in the blood. If they look normal, but yet you're tired, then we know nothing has been leaked to the blood. Then you have to look at the tissue. Is is your fatty acid adequate? Do you have enough or sufficient vitamin Bs? Do you have minerals? Right. So you can run those mineral panels. The more things you run, the more vials they take from the body. So typically, if you have to get more than 10 vials, that's like the tops. After getting 10 vials of blood drawn, you're going to feel so weak for a while. And remember, I said this, it takes at least 120 days for your blood to regenerate. So some folks are getting blood tested every month or two. I just don't recommend that. You just have to see, based on your symptoms, what kind of blood test you want to run. But vitamin D, you kind of have to run that, because vitamin D receptors, it's a genetic thing that could make or break a person. Not to mention how it helps your hormones and immune system at the same time. So those are some of the things that we could see.
Yeah, it's interesting. A lot of women definitely find themselves having low vitamin D, and sometimes they have these sad or depressive like feelings, and they know they're not sad or depressed. And if they get a vitamin D test, sometimes they'll discover like it's because they have really low vitamin D. But you have to almost ask for that test. Like that's not, again, one of the regular tests that they're just going to run, right? So
Right.
this does get a little complicated when you're dealing with your healthcare provider and having a knowledge of your body, having a knowledge of what are the standard blood tests that are done, because that still may not be revealed that really your only problem is you have low vitamin D. So,
I
yeah,
think since COVID happened, a lot of people are doing vitamin D tests. All my patients that come in with blood tests, vitamin D is included. I didn't have to ask for them anymore. That might be a good thing, except the interpretation is the key. Because remember this, you can get a 50,000 IU pill of vitamin D taken once a week. That's the equivalent of saying, you know what, D, why don't you just eat once a week? I'm going to starve you for 6 days, eat in the last day. That really doesn't work that way. It'll boost your blood vitamin D to a certain level, but also the way they interpret it, there is a range. If it's less than 30 ng per mil, it's typically low. It's called lab low, but we kind of want to see that at 50 or 60. When that is higher, then you have the enough cholesterol to convert the hormones, right, to make all the necessary hormones you need. But that brings up another thing. When we talk about blood tests, sometimes people don't take omega-3 testing, right? When you have to add all these tests, it gets to pile up. So vitamin D, you have to have cholesterol in order to convert. So you have to test for your omega-3, 6, and 9s. And typically, women just don't have enough fat. When they transition into perimenopause or menopause, their fat level goes down. I know they say otherwise. No, look at my belly fat. But really, that's just adipose tissue. I'm talking about like the omegas, the things that make your membrane, the things that make your hormones, which will also reduce inflammation. This is why after menopause, perimenopause, there is so much dryness. Skin gets dry. I mean, inflammation goes up because all these things are regulating the immune system. So D has become, not you, vitamin D. Vitamin D has become a really prevalent test now, which could be a good thing.
that's good to hear. That's good to hear. I know I have to still request it when I go to
I
the
know.
doctor to get my blood work. But I don't get, they don't fight me like they used to.
That's good.
So, yeah. So, no, that was very interesting. So, like, just kind of want to piggyback before I go to the next question on something you said about the omegas. So, how can we get in our diet omega every day?
I think we mentioned this last time about all the oceans pollutions. All of a sudden, there's another news that came out last week. It's really kind of hard to eat fish now. I mean, I actually, just for fun, okay, this is not anything, but I put a neodymium magnet and a ferrous magnet separately. I put that in and I tested on some fish, and the magnet just kind of went stuck to the meat. I said, okay, are we magnetic like that? But it didn't do it to some of the meats. So, I mean, I know we're not magnetic to, we're not supposed to have the magnetic field to silver, for example. Look, the magnets don't attach to it. But I'm just looking at the fish. I go, maybe I can't even eat that anymore. So to get the omegas, you could eat avocados. I mean, you could still eat salmon. I think salmon is still pretty good, wild caught. It's hard to differentiate because they don't have to label it. But if you want to get omega 3s, you can get it from a lot of the seaweed. I mean, the fish get their omegas from seaweed. So eating seaweed will give you omegas too. Um, Mushrooms are good. It contains the D2. Everything will be able to convert. You could eat nuts too. I'm not a big fan of nuts, but I'm not certainly suggesting don't eat nuts. But at least if you're going to eat them, you're going to have to eat raw. And usually no more than a handful a day. And also make sure you never eat fat and sugar together. Well, often. You can do it to enjoy life. But, that I don't want to say Trader Joe trail mix, but I used to like that a lot when I was younger because it has the dry cranberry, it has the roasted, I forgot which nut was it. Was it cashew? But it's got almond in there. Everything is roasted. So when you roast it, your enzymes go down. When you mix that with the good fat and the dry cranberry, which I think they sweeten it too, that just causes a lot of bad fermentation and it increases the candida and the bad yeast into your system. So I would say just eat the raw nuts if you have to. Eat some seaweed because they will, convert them into the omegas, and eat salmon because they don't live that long. They live roughly 3 years and they're like this big. So they're not like tuna where they grow this big, and the exponential accumulation of mercury is bad, for that. So
I'm so bummed about tuna. I love tuna. I can eat it every day, and sometimes I do. I
and that
know.
metal they will accumulate. I mean, they will accumulate in your brain. That's where they like to go.
Oh, okay. We can't have that then. I
Yeah,
might have to cut
so
back.
brain fog, and also our oxygen level in the air is so low, coupled with all the pollution and stuff that's going on. I mean, I'm sure people are feeling they're like gasping for air every day. They're just feeling dizzy, painful, brain foggy. There's all kinds of things going on. So, yeah, want to get checked out by your doctor to make sure you have enough minerals, vitamins, all right, these cofactors, and to make sure that you have the good fat in your system. We usually check for omega 3, 6, and 9. And of
Thank
course,
goodness.
vitamin D, right?
I love avocados, and avocados are used a lot in meals. So that's a good thing for people as well. Okay.
Just
So
one thing though, avocado toast, is that a good combo?
because the sugar in the toast.
And it could be gluten, right? So when you do
Okay.
gluten, and some people do like butter. If you do avocado, you probably don't do butter, but if you do a toast and avocado, that's good fat. But you've got sugar and you've got gluten in there. That combo may not be so good. Yeah. So we recommend maybe salad and avocado or celery sticks into guacamole.
Oh, okay. Okay. Interesting. Okay. Okay. So let's go to a series of questions that we've gotten regarding the tea.
Okay.
So there's so many pills and herbs that you can take on the market. What makes hot flash tea different?
Well, pills, sometimes there is a delay response and sometimes there is synthetic. So for the most part, once you have to go through the digestive tract, it lessens the potency. When you drink a tea, it can directly go past the blood-brain barrier for the most part, and they have precursors that make them do that. For example, if we want to increase the GABA, then we have to have the accompanying L-theanine to go get in. Therefore, green tea is a good way to introduce that. But our tea is more potent that way. You can feel it faster without it hitting all the different systems. Basically, if you take any supplement, the system of your body that is in most need, they will snatch it up first. So tea could be faster without having to have a delayed release, or people with digestive issues, they would find it less invasive. And it could be enjoyable. People who love to drink tea, I mean, you don't have to drink it hot. You can drink it cold too. We brew it and then we leave it and let it sit. It becomes cool, and then we put it in the fridge in the summertime.
Yeah. Yeah, it's really good. And it naturally sweetens. That's the beauty. This tea is so amazing. It's just got all kinds of little secret pieces to it.
Yeah. Oh, I gotta clarify. I'm not drinking the hot flash tea myself. I'm drinking the main ingredient in there. I gotta clarify that.
Yeah. Okay, because it was funny. Yeah, I have a question here. My husband gets hot flashes. Can he take the tea too?
Okay. Well, that's the thing. I mean, typically it's kind of neutral, but I would say no for the wife. Yeah, probably for the wife. I mean, we're not the ingredients in the tea. We're not building estrogen, so it's not
Right.
like he's gonna produce male breasts or anything like that. But I probably won't recommend men to drink it. For women, yeah. But still, please go see your doctor because they will know what you need. Because sometimes you may not need a tea. Sometimes you just need a fine-tuned component. Maybe you just need some vitamin D. Maybe you just need some vitamin B, B as in boy. Right? Sometimes you could need iron, but I'm not big on iron because it's an oxidizing agent. I got to make sure I see the blood test where your ferritin, your TIBC, all those are off. Then we say, oh, okay, that's the only thing that's off. We need to make sure we get some iron in there. And I still don't supplement them iron. I give them something called like blood builder, where they can use your probiotics to convert like cobalt directly into the iron that we need. So yeah, there's many factors. I would say men need to go see. Men don't like to see doctors. I know. Just go see a doctor. Make sure you need something.
Okay. Our next question around the tea is, will hot flash tea help me lose weight that I've gained through menopause?
Typically, that tea itself, maybe weight loss is something that I don't like to guarantee because there's again so many factors. Whether you eat well, whether you're sedentary, whether you exercise, there are so many factors involved. Your metabolism, your thyroid, adrenals, they all come in play. So I would say that tea is not designed for that purpose, but you certainly can.
Okay. I think this is our last tea question. I'm taking hormone replacement therapy. Can I take the tea too?
What kind of hormone replacement therapy?
Usually, well, they didn't say, but let's just say it's estrogen and estradiol.
Normally, they don't affect it because when they use hormone replacement therapy, they're meant to balance the hormones so you can reduce hot flashes or night sweats and things like that. So this will only buffer. When we say buffer, that means, for example, if you take GABA pill, if you take 600 milligrams per pill, you can raise it up to a point where it beats that threshold. When you drink naturalized stuff, their components are small, so it's a synergistic effect. When you take a tiny bit of everything together, their effect is multiplied exponentially. So when you drink the tea, for example, it will not go over your threshold. It'll keep it at a buffering level like your blood pH. So I think, and I lost track, sorry. What was the question again? I was trying to go somewhere with that.
Okay.
What was the question?
I'm sorry.
I knew I was going somewhere with it.
This was the hormone replacement therapy. And can you
Okay,
take
is it going to
tea
affect
too?
it? No, yeah. So if they're doing hormone replacement therapy, they are usually doing one or the other. So the tea will only buffer it and keep it at a normal level, and it will not increase that hormone or this hormone to a point where they go overboard or go into an imbalance. That's what I was getting at.
Okay.
Oops.
Okay. Actually, there was one more question. I missed this one.
Okay.
Can I drink this tea while taking birth control? So it's probably the same.
Typically you can. Again,
Yeah.
it's like food. None of these things are meant to throw you into imbalance, because I notice there is a trend when people come in. I have a lot of patients that love natural stuff, but there is one tendency they like to do. They take all their medications, which has a lot of side effects. I won't name all the side effects, but when they do, let's say vitamin D or something really natural, and then they have a symptom. Hey, Dr. Pei, is it the medication? No, sorry, is it the supplement that's causing that? And I said, usually no, but we should be looking into the medications for side effects. But again, when you're taking anything, the tea is so. I mean, the doses in there, the concentration of everything is very minuscule. It's not going to cause that, but they are enough to make a change. They're potent, but they're not going to cause detrimental effects. So yes, I would say it's safe, but once again, please confirm your doctors so that for any contraindications. For example, if you're pregnant, okay, maybe not. You know.
Okay. Our next question is, why is my hot flashes more at night?
So we know that when we wake up, cortisol goes up, supposedly. If your cortisol is low in the morning, then you tend to become much more fatigued. As the cortisol goes down in the nighttime, your your pineal gland and your hypothalamus start to take over. They start to govern and increase temperature because when you sleep, that's when the immune system goes to work. Your melatonin, your serotonin, all that kicks in to boost the immune system. And then it's going to start fighting something, whatever you have. Typically during perimenopause and menopause, where all the hormones decline, the immune system goes down, viruses and infections come up. Now the pineal hypothalamus will form an alliance and then they will fight, and that happens mostly at nighttime.
Complex, but I got it.
Was it too confusing? Wait a minute.
It wasn't confusing. If you don't know what the pineal gland and the
Yeah, I mean,
hypothalamus
it's like your
is,
third eye,
that could
but
be
it's a gland that governs your circadian rhythm. Hypothalamus is the master switch. It's next to the pituitary, but it really sends signals and pulses hormones into the pituitary so that your pituitary will release most of your hormones, your endocrine hormones. So hypothalamus really is the command center. Without it, pituitary cannot pulse out the hormones. And for that reason, because they need to pulse out the hormones, they are exposed and they're prone to infection. They're exposed outside the blood-brain barrier that makes them more exposed. You don't have these brain fibers that could act as immune boosters. So they get infected and you have hormonal problems, which is why they are sort of hand in hand. Yes. So when the pineal, which is using your folate and your vitamin D and serotonin to make melatonin, which melatonin is used for sleep, of course, right? But it's also used to guide your immune system into antioxidants and into immune, let's just say, getting rid of viruses and infection at nighttime. So that happens at nighttime most of the time, and this is why we say sleep is so important, because I might have mentioned it before, but in one of the TED Talks years ago, people first learned that when you're sleeping, your brain actually shrinks. Your cerebral spinal fluid would start to come up, and it would start to rinse off and all the toxicity, right, because there's not much lymph nodes other than down here. So it'll rinse off the toxins. The CSF, cerebral spinal fluid, comes down, your brain goes back, you wake up. So this is the main reason we want to sleep, so that the melatonin can go to work, your immune system go to work, and your plumbing in the brain can work. Otherwise, you're full of, inside if you don't sleep. So it's a beauty thing.
got it. Okay, so I need to get more sleep now.
Yeah. That's why we always admire Kobe. How can he do 3 hours, 4 hours sleep? It's impossible.
Right. Yeah.
Yeah.
Yeah. It doesn't.
I don't know
Yeah.
how
You
long
can't.
around that. I need 7.5 hours now. It
Yeah.
used to be
What I
cut.
found, I know a lot of really smart people, real high Q intelligence, who brains really don't quite shut down, and they wake up after shut going down. They wake up 2.5, maybe 3.5 hours later, and they get back and work a full day and do that. What I found as they get older is they have cellular damage,
Yeah,
right?
for sure.
They
Their
have
adrenals are,
cellular body damage, and a lot of times they're in these unique research programs trying to figure out what's going on with them, when really is that for decades they lacked sleep because they were constantly using their brain, writing books and doing whatever they do.
yeah,
Yeah,
life is like a flash.
yeah,
It's a
exactly.
flash in the pan, but we like to have that beauty sleep, mainly because I need that for energy. I used to be 6 hours, and then as I get older, it's 7 hours. Now it's 7.5 hours.
Really?
When it reaches
I
9 hours, I'm retiring,
mean,
and I'm only 43. 7.5 hours. But you see, everyone to each their own. Everyone's different.
exactly. And
Yeah.
on that note, that's a perfect note to end by saying all of us are individuals. We all have a different imprint. And our bodies are all unique, so there's not one solution for everyone. And as Dr. Pei has given a variety of things that could be causing even some of your menopausal symptoms, it's all going to be different depending on environment you're in, depending on genetics, depending on what you eat, how you move your body, depending on whether or not you've had toxins inside your home, like mold, overuse of chemicals, cleaning your house, things like this, new cars, new carpet, the list goes on, and all that impacts that uniquely individual body differently. So, Dr. Pei, thank you again for joining us. We
Thank
look
you.
forward
Hey,
to
T,
seeing you next month.
before I end, I like your shirt. It matches to the painting. It's really,
Oh, thank you.
really cool. Okay. Well, thanks
Thank
for
you.
having
I'm coordinating.
me. Okay.
Okay. All right. Bye-bye.